Hello, everyone. This is Dr. Hashem Hasabala coming to you with another episode of the Healthcare Musings podcast. Today, I wanted to take some time out to celebrate respiratory therapists. This week is National Respiratory Therapy Week, Respiratory Care Week, and as a as an ICU medical director who works every single day hand in hand with respiratory therapists. Um, I also have the honor of being the medical director of respiratory therapy at the Chicago area hospital, which serves as my base, my home. Um, I wanted to take some time out to really highlight the absolute importance um, of respiratory therapists and their role in the care of a critically ill patient. Um, we cannot do our jobs properly without respiratory therapists. Many patients who come to the intensive care unit are intubated, meaning they have a breathing tube inserted into their throat, connected to a ventilator or a machine that helps them breathe. And respiratory therapists are dedicated specialists to help run and manage mechanical ventilators, in addition to helping other patients in the intensive care unit breathe better, whether with oxygen or bronchodilators or other medications that help their breathing, or inhaled nitric oxide gases, or even as complicated as ECMO, external um, heart lung machines. They are such an important part of the job we do. We cannot, the team is not complete without respiratory therapists. And I mean that wholeheartedly. They are not just knob. I told my team when I first became medical director, you are not a knob turner. Anyone can turn buttons on the ventilator. They are specialists dedicated to helping patients breathe. And there was a saying of the American Lung Association that when you can't breathe, nothing else matters. And that is so true. And these people, these dedicated clinicians, help people breathe. And that the value of that cannot be understated. And my appreciation for them and my gratitude to them and for them cannot be understated as well. Um, you know, if you want to purify gold, you need to actually put it through a fire, like a process where you heat the gold under extreme heat and temperatures to get out the impurities, to make it pure gold in the end. Um, I think the process is called smelting, if I'm not mistaken. And the COVID-19 pandemic was that fire. And just like the bedside ICU nurses, what I witnessed as far as heroism and dedication and selflessness, putting their own lives at risk to help hundreds upon hundreds of critically ill patients with COVID-19 is nothing short of awe-inspiring, nothing in short of humbling. Um, and my gratitude to them, like I said, it goes beyond words. So this week we honor them. This week I honor them. Every day I honor them. And I just wanted to make sure that I took this time out to say thank you to each and every one of those respiratory therapists who help us at the bedside, who help our patients breathe. The ones that have stayed at the bedside after the fire of COVID-19, those people, everyone is great, and the ones that are still with us, that have stayed at the bedside, to me, are pure gold, 24 karat gold, and I cannot appreciate them enough. Thank you so much for listening, and until next time, this is Dr. Hashem Hasabala for the Healthcare Musings podcast.